Welcome back. May is National Stroke Awareness Month. According to the American Stroke Association, stroke is the fifth cause of death and leading cause of disability in the United States. A stroke happens when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it bursts or ruptures. It can happen to anyone at any age. The good news is 80% of strokes may be preventable, according to the National Stroke Association. Joining us now here on First at 4 to discuss the different types of strokes and their effects and also the signs of stroke is Dr. Garrett Conyers, stroke neurologist and medical director of inpatient neurology at U of M Health. Thanks so much for joining us, Dr. Conyers.
A pleasure. Thanks for having me.
Let's just start with the basics. Describe for us the different types of strokes because they are not all the same.
Yeah, that's the first distinction. We typically talk about two main types, hemorrhagic and ischemic stroke. And just like you said, the brain needs blood to function healthy like the rest of the body. And so hemorrhagic strokes are when you have a blood vessel that ruptures or breaks and blood spills out of the blood vessel. Sort of like if you have a leak in a pipe in your house and it leaks out. So you don't get water to the spot that you need and you have a problem elsewhere. So that's a hemorrhagic stroke. And the second type, ischemic stroke, is probably what most folks think about. It's when you have a blockage in a blood vessel or a very, very narrow blood vessel or pipe. You're not able to get enough blood flow to the section of your brain that needs it. And so you start to have symptoms that we recognize as stroke.
The acronym FAST is how the medical professionals or medical community describe what happens to a person when they are having a stroke. Explain FAST for us.
Yeah, so FAST is critical. This is one of the things that we want all patients, all people in the community to know about. It's essentially, when should I kind of be on response and urgently go to the emergency room or seek help? And so we say FAST. So the F is for a facial droop. So, when you're smiling, is it symmetric or is it kind of offset and asymmetric? So facial drooping. Another thing we say is arm weakness. So if one of your arms suddenly becomes weak, we worry about stroke. The next thing, S, is for speech difficulty. And so this means slurring of speech. Sort of like, if you've heard some people who have maybe drank a little too much and they're slurring their words together, concerning for stroke. And then another part of the speech difficulty is the inability to get words out. So speaking, but the words making no sense, putting them together in ways that don't make sense, or being able not to understand language when people are talking to you. That can be a sign of a stroke. So speech difficulty. And then, so if you recognize any of these, facial drooping, arm weakness, or speech difficulty, we tell you that time matters. And so it's time to call 911.
Yeah, and Dr. Conyers, if a person is having a stroke, they may not be able to get help for themselves. So what should a person do if they think someone is having a stroke?
Yeah, so stroke, I think there's a propensity or there's almost a sense of trying to figure out, is this a stroke or not? What should I do? I tell everyone, all my patients, if you see any of the FAST signs, just immediately call 911. This is one of the diagnoses or the medical emergencies that is time dependent, meaning if you show up to the hospital, we're always looking for a specific time. We're eligible for certain treatments if you show up within a certain time window. And so the quicker you can identify that someone's having a stroke, the quicker we can get you to possible treatment. And so the fastest way to do that is to call 911.
And what causes a stroke? Many people link it to high blood pressure, but I guess that's not the only cause of stroke, correct?
Yeah, it's very complex disease. There's several things, but like you said in your introduction, there's a lot of risk factors that we can control. And so high blood pressure is one that we know historically really influences your risk of stroke. But other things like smoking significantly increases your stroke. Having diabetes, having high cholesterol, being obese just in itself, having a lack of physical activity. These are all things that put you at a significantly increased risk of having a stroke. But the good news is that these are things that you can modify, meaning you can reduce your risk by managing them appropriately.
And I was reading that, stroke can happen to anyone, and there's been some reporting that there is an uptick in younger people in that age range between 18 and 45 having strokes. Is there anything you can attribute to that age group having, more strokes than I guess what they typically had in the past?
Thanks so much for asking that question. That's a great one. When we look at over time, kind of the incidence or the number of strokes in this younger population occurs, we know that it's happening more now. So we call it stroke in the young is the word we use in medicine. Um, and they do suffer the same risk factors, right, that we just talked about: high blood pressure, smoking, cholesterol, diabetes. But we also see that they have a slightly higher representation of other causes of stroke, things like blood clotting disorders, things like arterial dissection, which is like a small tear in a blood vessel in your neck. These are things that we see specifically in this population that are more frequently associated with stroke as younger folks. And so we're still trying to understand why exactly this is happening. I tell people that the biggest thing you can do is be plugged in with your healthcare provider, as soon as you're an adult, right? A kid and an adult, to help identify some of these risk factors.
Very helpful information here for us today on First at 4. Thanks so much, Dr. Conyers, stroke neurologist and medical director of inpatient neurology at University of Michigan Health. Thanks again for joining us today, and have a great afternoon.